I thought she was going to die, and then it just turned out the opposite. She lived. This is a story of a young woman who was assaulted with the back end of a hammer and hit repeatedly over the head. I was on trauma call, so she came to the emergency department. When I first saw her, she was unconscious in a coma. She had a large laceration over her scalp that was bleeding profusely, and it looked like there was brain matter coming out of the scalp. She was taken for an immediate head CT, which demonstrated her skull was fractured in multiple spots, and there was bone pushed down into the brain with a blood clot under the fractured bone. I took her emergently to the operating room to try to save her life. I thought she wasn't going to survive. Once in the operating room, I positioned her, shaved her hair, and I could still see some of that brain exuding out of the scalp. I made a large incision so I could expose all of the fractured skull plus normal skull. I could immediately see that the covering of the brain called the dura was torn and there was brain oozing out. At this point, I slowly began to take the bone fragments out of the brain. There was hair that had been pushed down in the brain that was taken out. As I went a little bit deeper into the brain, there was that large blood clot, and I was able to remove that blood clot in its entirety. You could already see after I took the blood clot out, the brain became much more relaxed and it was now pulsing like it should. Once I had the pressure off the brain and I cleaned the region out, then what I did is I took those bone fragments and I tried to piece them back together with titanium mesh, and then I kind of recreated her skull at the area of injury. Surgery had gone extremely well, but I was still worried that the patient was not going to do very well given the extent of her injury. She was then taken directly from the operating room to the intensive care unit. She still had the breathing tube in, and we just needed to keep a close eye on her. The family had arrived, and I explained to them that she had a bad injury to her brain, and I couldn't give any guarantee of how she was going to do after surgery. But I definitely prepared them for the worst. The following morning, I came in to see her, and to my surprise, she was awake with her eyes open. She was now following my command. Later that day, the breathing tube was taken out. The patient was awake and talking to me, and she had no deficits at all. She went on to make a complete full recovery.